Hi there. Right, so I mentioned in the last video, the one on the first few minutes of the consultation, the importance of timeline. Now, this is absolutely vital for working out not only the diagnosis, but what's the natural history of this condition, how is it progressing, and then using that information to then predict what's going to be happening in the next few weeks or in the future. The other important thing that was mentioned in that last video was by having a few set questions that are in your brain bank ready to use when the patient stops talking in their opening statement. The more you can listen, if you're listening properly, you can take in more, because you know this is one of the questions. And that question was, take me back to the start. When exactly did it first start, and what sort of symptoms did you have at that point? And then with the time frame, you're going to be using the time frame, the timeline, to work out, to find out more about the symptoms and how they were presenting, working your way through. Now, this kind of replaces the more traditional symptom-based inquiry that most doctors will use. So you might be given a range of symptoms, and then you might want to clarify, tell me more about your pain, tell me more about the abdominal symptoms, tell me more about your stools, whatever it might be. And which is okay, and you will clarify the symptoms, but you're going to be then left with, okay, we've got this symptom, and we've got this symptom, and we've got this symptom, and we're not really so sure how they link in together. So doing a timeline based approach gives you a much better idea of what's going on. Patients may present to you with a perfect timeline. They might say it started on this date with these symptoms, and then this happened and this happened. More likely you're going to get a mix. You may get all of the symptoms that have happened at any point as if they're happening right now. You may get the symptoms that are happening right now and not the ones that were happening before. And you may also not sort of really fully understand how things were fluctuating with time. It may be that things are gradually worsening each day, or it may be that you're getting a flare-up and then symptoms are improving. So really understanding that sort of way the symptoms are progressing or changing will help. The other kind of byproduct is that if a person has a range of symptoms, or it's been going on for a few weeks or a few months, it'd be quite hard to think back to that first moment and why did it first start. So that ICE question, have you got any thoughts on how this started or why it started, can be quite hard for a person to remember back. But if you're linking back to that first moment and those first symptoms, then it's a nice opportunity to do that. But that's an aside, that's something separate. We'll do a separate video on that. The other thing to look out for with time frame is to really be specific and accurate on the time frames. Now, patients may come out with phrases like, it's been happening for some time, or it's been going on for a while. Now, I've had two patients, one after the other. First one told me something been going on for a while and it was 10 years. The next person said for a while and it was 2 weeks. So you can't trust those kind of vague terms. You have to understand what it means. Even, say, with an infection, if someone says it started last week, starting on Friday or starting on Monday might actually make double the length of time the condition's going on for. It's always worth clarifying what people mean. So, if we look at acute conditions, so something like an upper respiratory tract infection, you may be given symptoms of sore throat, fever, and painful glands. Now, sounds like something you might be assessing for antibiotics. If the condition started 4 days ago with a sore throat and high temperature, next day glands are up, yesterday glands are going down, no more fever, today no fever, glands are getting better, sore throat's a little bit better, then you're very unlikely to be thinking about antibiotics. If, however, every day the symptoms are worsening, and then yesterday fever started, today the glands are up and big, then the trajectory is going upwards. So it's obvious that understanding the time frame there was really important. With the conditions that are maybe semi-acute, so something like a tendinitis injury that may have been present for weeks or months, that might be worsening and gradually. Probably more likely is it rises a bit, flares, and it eases off a bit, and then it flares, and then it eases off a bit. And kind of understanding that time frame will help, because if you say make an intervention, next week it was probably going to improve because that's what it was doing over the last few weeks. So it's probably going to do the same. And also that understanding that how things can worsen and improve, you could then link in to the patient, trying to work out why was that. So when that improved, why was that? When it got worse, why was that? And there may be conditions that have been several in the past. There may be a condition that you may be presented with the symptoms as if this was the first time it ever happened, but actually there may have been an episode months ago or a year ago. So worth looking for those sort of things. There was one of the videos I did, consultation model 4, CM4, health belief model. Worth having a look at that if you skipped over it, because that looks at why do patients present when they do. So it kind of links into this as well. So what sort of phrases to use? So we've got our first phrase. What we would then need to do is use mini summaries or clarifications or further open questions to work through the time frame. So let's say a patient presents to me with a range of abdominal symptoms. I could then use the phrase, so take me back to the start, right to the start, when it first started. When exactly was that, and what sort of symptoms did you have at that point? And I might get the answers back and then say, so started 4 weeks ago with some bloating and you noticed your stool's a bit loose. Did you have any other symptoms at that point? Okay, and then how long did it last just like that before things changed? Okay, so at 2 weeks you started to notice some mucus in the stools as well. Did anything else change at that point? Okay, and then you just move on. So you can do your symptom based approach. You can clarify a bit more about certain symptoms that you need to, but overall you're using the timeline as your method to do so. For conditions where there have been others in the past, you can use reference points through the year, or even the medical records as well. So for example, with our person who had abdominal pains 4 weeks ago, you could say, so 4 weeks ago, so that was the end of August. And did you go on summer holiday this year? Okay, so you didn't have any symptoms at all at that point. Oh, you did? Okay, so actually you had some mild nausea just before the summer holiday. So we're looking about 8 weeks actually since the first started. Notes. Yes, the notes. So you may say, so you said that you had an episode similar to this about 6 months ago. I can actually see from your notes here that you had some blood tests about looking for bowel conditions about a year ago. Do you think that was the episode you're talking about? Great, okay. Actually, and just reading the text from the doctor you saw then said that this is your second episode. You'd had a mild episode about 6 months before that. Does that sound about right? So you can actually clarify from the notes where there's something in the past. You may have spotted it when you were looking at your notes before calling the patient in, or it may be if you're thinking about doing a further investigations, you're going to check what investigations they've had already, I hope, to then see, and you might spot something that might be relevant. You might also... So what was I going to say? Last thing, so that first question, take me back to the start. So there might be some slight variations on that. So always try and tailor these questions to the patient if you can. So for example, if they'd already told me it started 4 weeks ago, I could say, so started 4 weeks ago, exactly what symptoms did you have at that point? Or they might have told me the symptoms but not the time frame. So I might get, so you said it started with feeling slightly nauseous and then you had the abdominal pains. Exactly when was that nausea? When did it first start? You may be given, like what we just mentioned before, about there might have been several episodes. So I might want to say, so this current episode, take me back to start. When did this current episode start? And what were the symptoms at that point? Or it may have finished already. So take me back to that last episode you had. Exactly what was that? So different variations on that first question. Okay, I hope that makes sense, and good luck.